So it gives me great pleasure to introduce our next speaker, Morgan Gleason.
Hi.
So Morgan is a high school student, but what a refreshing way to hear about the patient experience than through her voice. And she is a very passionate patient advocate because she believes that every patient deserves to be heard, regardless of their condition or their age. Morgan posted this video while she was in the hospital, and it just created a life of its own. It went viral. And it's been featured in Forbes, in numerous magazines, on TV, and she has spoken at the Cleveland Clinic at their empathy conference. And as I spoke with her, I just felt that she had such a refreshing approach to hearing about the patient experience that I felt it would be great to have her at this conference, particularly since we do use her video quite often, and many of you had seen it once before, so welcome. We really appreciate you being here, Morgan. So Morgan, maybe we can start out with you just sharing a little bit about your medical journey, what you're comfortable with, and then let us know why you felt that it was important to become an expert in healthcare and in the patient experience.
So when I was 11, I was diagnosed with a rare autoimmune disease called juvenile dermatomyositis. And this is basically a vascular disease that affects the skin and the muscles. And it causes muscle weakness and fatigue, and it also gives me a rash in all of my joints. So over the past 4.5 years, I've accumulated a lot of knowledge in the healthcare experience. So I take 21 pills a day, and I see 12 different doctors, and I'm admitted monthly for infusions. And so I made this video in January when I had aseptic meningitis as a side effect of one of my treatments. And I was getting high-dose steroids that made it hard to sleep, and I wasn't able to fall asleep. And then the doctors and the med students and the lab people and everybody you could basically think of were coming into my room at 6 in the morning and waking me up. So I was getting 3 hours of sleep at night, and you need sleep to heal, and so that made me very frustrated. So after 4 days of that, I became very frustrated, and I started venting to my mom one day, and she videoed it to send to a couple of friends, and that was the video.
And the next thing, and the video happened. So you created the video. Her mom posted it, and we do have Amy in the audience, so thank you so much, Amy, for joining us. It was posted, and then it went viral. And for those of y'all who were here at our last summit, ePatient Dave saw the video, so of course he sent it to countless people. But why do you think that so many people and so many organizations are interested in that video? And did you expect that type of reaction from?
So I definitely did not expect that reaction. My mom made the video to send to a couple of friends, like I said, and I probably would have thought twice about making it if I had known that so many people around the world were going to see my horrible hair day. So. And I think just a lot of what I was saying is such a common experience with so many patients, and I didn't realize that when I made it. I just watched, I remember sitting in the room, in my hospital room, just watching the numbers on the Forbes page refresh, and it was climbing, and I was so confused as to why so many people, because I had no idea that so many people were sharing the same experiences that I was, so.
Well, and I think it's, in addition to people sharing the same experience as you, I think a lot of people like us, healthcare related people, really took a look at it because of what you had to say and your plea to listening to patients. And as we've done our research, we've certainly seen that that is the one thing our patients here talk about. Regardless of how many patients we videoed, the key element that they talk about is, I want to be heard. And so that's probably why that number kept clicking up and up and up. So it sounds like you've had a lot of opportunity to see what really goes right in healthcare and what doesn't go so right.
Right.
So in addition to not letting you sleep, can you share with us a time where you felt that you had to push back a little bit with one of your healthcare providers just to get the care that you really wanted or needed that was important to you as a person? You know, not your condition, but as a person.
So I have a couple of experiences where I've had to do it, and there's one experience that comes to mind especially is when I like to get my IV done and my labs done separately, because I personally think it hurts less when they don't have to wiggle around the IV in my arm to try to pull out the blood. And I also think I found that it gives a better sample because it doesn't clot as frequently as when it's done that way. And so a lot of people think that's very strange, because why would you want to get stuck twice? But so then when the IV lady, I overheard the IV lady and my nurse in the hallway one time, and the IV lady was telling my nurse that I absolutely refused to allow her to stick me to get the blood from the IV, when I thought it was very strange, because I thought it was a pretty simple request for me to ask that, because it felt better to me. But so that was one time, and then there was also another time where I've had to talk about it with my. There was a second time. The most recent time I was in the hospital was when the phlebotomist again came to draw my labs, and she only had one tube. So I told her while the needle was still on my arm, well, I normally get 5 or 6 tubes done at the same time, and she didn't believe me, so I ended up having to get stuck twice. So if she had just listened and drawn extra, even though, I mean, it could have caused me a lot less, like I wouldn't have to get stuck 3 times because of the IV and then the 2 lab draws.
So it sounds from that comment that, it's not only listening, but then also following up on the actions. Right. So it's one thing to listen and talk about it, but then what we do after you've talked and shared with us your preferences, that really shows that we truly heard you.
Right.
Okay. I think you created another video.
Yes.
And in that video, and we'll show it in just a minute, but in that video you point out some of the things that we've put in practice that to us makes a lot of sense, but our patients may be questioning why we do things certain ways. So I think we'll show that video now.
Hello, my name is Morgan Gleason, and I'm here to talk to you today about something that is not patient-centered in the healthcare world, and that thing is the IV pump. Whenever your IV pump has an issue, like my issue with it is that I get a certain med that is very frothy and bubbly, so in the middle of the night, like air bubbles get stuck in the tubing, so every time the air bubble gets stuck, the IV pump starts beeping extremely loudly, very louder than your alarm clock loud. So that is very annoying, especially when you're sleeping, because it wakes you up like it's an alarm clock. And also, when you have a headache, it really doesn't do well because, sound, really loud noises hurt your head. So it just doesn't make sense why it would beep in the patient's room instead of out by the nurses where they could actually do something about it. The patients aren't able to do anything except press a silence button on it, which is a little button that like only kind of makes it the beeping stop for a couple minutes at a time, maybe 2 or 3 minutes at the most. And if your nurse doesn't come within those 2 or 3 minutes, then your IV pump ends up beeping the entire time for like over and over and over again until somebody finally comes in and fixes it. But then when you do need the nurse because it's beeping, you have to press this button. It's the nurse button on the little remote. And it, like when you press it, it goes out, it gets sent, your remote signal sends to somebody sitting in the desk outside the hall. And that person is supposed to page the nurse for your nurse to get the page to come to your room, and then they have to like fix it. And a lot of times, a couple of times it's happened to me. It doesn't happen very often. They're normally pretty good about it. But a couple of times it's happened where the person at the desk will turn off the light outside of your room, so you're waiting for 30 or 40 minutes at a time without anybody knowing that you need anything, which is really annoying because you've been waiting for a long time, you're in pain, the thing is beeping, it just doesn't make sense. No, it really is annoying actually. Also, there's a pain button on the remote which does the exact same thing as the nurse button, and it doesn't make sense that they would have a pain button if it does the same thing as the other button. The people still come on and ask you what you need. Like, do you need anything? Do you need your nurse to come? And you're like, yes, I pressed the pain button, I'd like something for my pain. And they're like, well, I don't know, it just said the same thing as the nurse button. So that's not very helpful at all. And yeah, that's all I have for you guys today, but I'll post a new video soon. Thanks for watching, bye.
So, again, things that we put in place that we think make a lot of sense, and how we explain it to patients, and then the true patient experience. I got this call light, I can press the button and they're gonna know exactly what I want. It says pain, press the pain button, and she still has to tell them what exactly she wants. So great food for thought for us as we go back to the different facilities, talking with our patients and how we explain things to them. So great job of just pointing some things out. And I think that laughter in the crowd was nervous laughter, like, oh yeah, we do that. Jason talked a little bit about the definition of patient experience. And he talked about how organizations truly have to know the patient experience and what the definition of patient experience is. And as we've, over the past year, been talking more about the patient experience, we really came up with a definition for Dignity Health. And that definition is truly built on our mission, vision, and values, and supports our mission, vision, and values. And one of the main components of the patient experience definition is the need that our patients come to us for. Without that clinical need, we wouldn't necessarily have patients in our hospitals or in our clinics or in our medical practices. So an integral part of the patient experience is that true clinical need and how we treat that clinical need. But there's also the feel. How did we make our patients feel? Did we treat our patients with empathy and compassion? Did our patients feel cared about? Or did they feel a burden? Some of the videos that we've shown, the patients didn't feel like they were welcomed in our organizations. And then you saw the video of the patient who just felt bathed in love during a sponge bath. And then the third component of the patient experience is the look. And when we talk about the look of the experience, we're really talking about those environmental factors. What did our facility look like? Is it clean? Is it dirty? Is it loud? and do those beeping noise, keep our patients awake. So those three components together really create the patient experience at every touch point that they have. And then weaved within every one of those touch points is our human kindness. And our human kindness is what will set Dignity Health apart from other organizations. So as you think about our definition of the patient experience, can you share with us some of the positive experiences that you've had? Because you've told me quite a few of those positive experiences, but some of those positive experiences that really made you feel cared about, not just your clinical care, but that emotional being cared for and about.
Right, so there have been several examples where I've felt cared about, but there have been three that really stick out in my mind. When I was in the hospital with meningitis again, and I had light-sensitive headaches, and the light from the IV and the computer would bother my head, my nurse came up with a really simple idea of just putting a blanket over the IV bowl, which helped make my head feel better, and it made me feel like I was cared about because she took the time and effort to come up and care about something enough to come up with a solution for it. And then another time is there are several nurses at my hospital who really go out of their way and take the time to make sure that the beeping during the night doesn't interrupt my sleep. And they really seem to care about how I feel and making sure that I get enough sleep. And it makes me feel really nice to know that so many people, so many nurses would like to take the effort to make sure that the beeping doesn't interrupt me. And then there's another example, my doctor in January, or I guess late December, when he was considering taking me off the hospital homebound system for the second semester. And the hospital homebound program is basically where the school sends teachers to my house so I don't have to actually attend the classes when I'm not feeling well. And they send them for an hour each week to teach me my lessons. And so we were discussing that, and after, he was concerned that I wasn't getting enough socialization from being at home all day, but I enjoy riding horses, so I felt that by not going to school, and I was able to have enough energy and feel well enough to ride my horse and also do my schoolwork. I felt that was a much better solution for me while I was still healing. And then for him to want to discuss that with me and see my viewpoint on it, and we were able to discuss that, and I felt like he respected my opinion enough to want to discuss that and come up with the best plan for me.
So, if we look at a couple of those separately, I think the examples that you gave of the nurses, about how much time did it take the nurse to put that blanket over the IV pump?
About 5 seconds.
Okay. So 5 seconds of time, and it made an impact on you.
Right. I tell it at every speaking thing I go to, so it made a big impact.
It was a huge impact, and it was 5 seconds. And so, sometimes we think we don't have time to show that kindness. Here's a great example, 5 seconds. And thousands of people hear about that experience. And your physician taking the time to find out what was important to her, what's the most important thing to her. And it wasn't necessarily to reduce the number of pills you had to take, but it was really something personal in her life that meant so much. Her Riley?
Yes.
Yeah, her horse, Riley.
Yeah.
Okay. So, sometimes as healthcare providers, we don't necessarily think that our patients want to be that involved in the healthcare process, and think that we should tell them what should be done. So you've got an opportunity to tell quite a few people what would really help them to change their mind about that. Not that all of not that all of us feel that way, but if everyone in this audience felt that way, what would you tell us to change our minds?
I think doctors believe that, first of all, because patients are taught that they aren't able to have a say in their healthcare and what's happening to them. I feel like patients, because they're taught that, they become submissive, and that gives out the impression that they don't care or they don't want to be engaged in their healthcare, even though they feel like they can't. They're told from the moment they're diagnosed or the moment they walk into the doctor's office that you must do this, you must do that, and they aren't given the opportunity to discuss their problems and their concerns with the doctors. So I think that I would tell doctors and nurses and anybody who works in the healthcare system that patients do want to be involved, they just don't feel like they have the say. I feel like the most important thing you can do is to communicate with your patients, because if the patients aren't being communicated with, you're not sure, because what you may think you would want in their situation is not always what will fit best with what the patient's lifestyle is. And I think we need to teach people how to become patients, because while you go to a med school to become a doctor, we don't go to a patient school to become a patient.
Yeah, there's not a lot of schools out there.
Yeah.
Sign up here, learn how to be a patient.
Basically, you're thrown out there and you have to figure it out on your way.
Yeah. And it's kind of a scary journey. Yeah, when you don't know what to expect. So, and I think often we will say, in all good intent, that we know what's best, and really, who's the expert in the experience? No, it's the patient. Absolutely. Okay. So I know that you have some favorite nurses and some favorite doctors, and probably some favorite lab techs. So can you describe what makes them your favorite?
So my doctor, I think he's really great, my rheumatologist. I think that the fact he takes time out of his visit, he plans to also talk about the medical things, but also talk about things like my horse, or how school is going, or what books I'm reading, or how my friends are doing, or what I did over the weekend. He makes a conversation with me. He makes a personable conversation where we discuss things, and he finds out things, how I'm feeling, by talking to me that way. And it makes me feel more like a human and less like the patient in room 482.
So I heard in your response, you talked about the clinical need. You know, he definitely talks to me about what's going on with me medically, but then he also makes that personal connection with me, which is so important. Okay. What about one of your nurses?
There are a lot of nurses. I think the same thing, the nurses who take the time to talk to you and not just come in there and take your blood pressure and fix all your meds, but to actually have a conversation with you when they have the time. I mean, I understand nurses are always busy, but if you have the time, if you have even 2 seconds to talk about how they're feeling, how they're doing, then I think you should take the opportunity.
Okay, good. We talked earlier about the patient experience definition, and you and I have talked about patient-centeredness. So could you describe to us what it looks like? What does patient-centeredness look to a patient?
So I think that to be patient-centered, I think everything needs to revolve around the patient. And you need to discuss with the patient what their lifestyle is and what would work best for them. You need to communicate with them. and just talk about things. Talk about what would be best for them, and don't just tell them that, well, this treatment is best, but you need to talk about the side effects of it. If the side effects are dizziness and they have something important that they can't be dizzy while they're doing it, then you should talk about it so you can choose a medication that would work best for it. So you just need to talk about it and make sure everything, also it needs to be convenient for the patient. Like if you have to wait 2-3 weeks to get an appointment, by that time the problem could have gotten worse, or it could have gotten better, and you wouldn't have been able to talk about it, and the doctor wouldn't know that it was that way because you didn't have the chance to talk about it until 2 or 3 weeks after. So.
And you can't remember what it was
Yeah.
that you wanted to talk to him about. Okay. So again, communication is key. And as we talked about our experience principles, that was definitely one of the principles that came from the voice of our patients. Communicate with me. And we hear it again countless times. Okay. And as I reflect back to some of the responses and some of the answers to our questions that you've answered, Morgan, I really think back to our experience principles. And so many of the things that our patients have told us and that we've created with the experience principles: know me as a person. You've certainly talked about what your favorite doctors and nurses do. And you talked about your physician who asks simply, what books are you reading? Right. Know me as a person, communicate with me. And I think every response that you've given us has been about communicating, empowering me. Morgan talked about, tell me what the side effects of the medicines are. Let me have the information that I need to make the right decisions. And so you're just validating, again, what our patients have told us and what our experience principles are looking like. So I think we have one last question to ask you. And again, a large group from Dignity Health. What final words of advice can you give us? You've heard about, we're really on a journey towards improving our patient experience. And we want to continue that journey and continue to have success with it. What final words of advice would you give us as we move forward in our work?
So there are 3 things that I think are really important. The first is that if you're not sure about something, or you're not sure if that's the treatment that you should be doing, you should always ask the patient. You should always, 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 always ask the patient what they want and how they're doing and what would they think would fit best with their lifestyle after you've explained everything. And then second is you should always treat the patient how you would want to be treated. Treat them like you would a family member, except you have to make sure the family member is somebody you like and not a family member. You have to make sure the family member is somebody you like instead of somebody you don't like. So that way, if you treat them like a family member, you can never go wrong.
And she used that always, always, always word. And we laugh at that word because that's with our surveys, our HCAP surveys, the response that we want is always. And I did not pre-plan. I didn't tell her to use that word. So I can't thank you enough for sharing your perspective of the patient experience in such a way that was truly engaging and inspiring for all of us. And the fact that you, at your age, want to share with everyone in healthcare the importance of really being centered on the patient. I applaud you. So thank you so much.
Thank you for having me.
welcome.
Thank you. So happy to see you.